Taiwanese people do not eat raw vegetables. No salads, no raw carrots with lunch, and definitely no leafy greens on sandwiches. Why? Parasites. Taiwan's warm, humid climate allows parasites to thrive, so leafy green vegetables are traditionally flash-boiled for safety. I know what you're thinking, but raw vegetables are healthy. In my country, we just wash vegetables and that's good enough. These are famous last words for foreigners living in Taiwan. While you can get salads or sandwiches with raw lettuce at Western restaurants in Taiwan, all it takes is one busboy coming into work hungover, and bam, you've got a case of roundworm from an insufficiently scrubbed kale salad. It's no wonder that Taiwan put in the effort to build the best healthcare system in the entire world. Taiwanese people live longer than 80 years on average, even though Taiwan spends less than 7% of its GDP on healthcare. By comparison, the UK spends more than 10% of their GDP every year to achieve a similar life expectancy. What makes Taiwan's healthcare system so awesome? And can the magic of Taiwan's system be replicated in Europe and the USA? Welcome to ChinaTalk. When Japan's invasion force arrived in Taiwan in 1895, the Japanese soldiers found themselves on a pre-industrial jungle island filled with disease. Malaria was rampant, and the Japanese soldiers began falling ill and dying by the thousands. This is why a haphazard approach to healthcare was never an option for Taiwan. The weather is humid year-round, and winter temperatures never drop below freezing, except for on the top of the island's tallest mountains. That means there is nothing stopping microbes, mold, cockroaches, rats, and mosquitoes from thriving season after season. For the Americans in the audience, just picture Miami with more bubble tea. Once the Japanese colonized Taiwan, the first item on their agenda was building a modern health and sanitation system. The Japanese built hospitals and sewers, as well as quarantine and vaccination facilities for sailors arriving at Taiwan's ports. They enlisted the help of local police forces to crack down on illegal dumping and bad hygiene. Even more importantly, the Japanese trained local Taiwanese people to become bureaucrats in the expansive colonial health institutions. The KMT expanded these health networks even further, building veterans' hospitals to serve the troops arriving in Taiwan from the mainland. This laid the groundwork for Taiwan's exceptional modern healthcare system and created a health-conscious culture that frowns on eating with your hands, consuming vegetables raw, and going maskless when you're sick. Taiwan's deep respect for doctors even played a role in the 2024 presidential election, when a surgeon named Ko Wen-je ran for president as a third-party candidate and received a quarter of the votes. Taiwan eliminated malaria in 1965, but other tropical diseases persist, including hepatitis A, dung fever, enterovirus, a hyperinfectious tropical virus that causes fever and canker sores, and Chagas disease, which is spread by the bite of this terrifying insect known as the kissing bug. Now that we understand the stakes, let's break down the details that make Taiwan's modern healthcare system so magical. So, you get sick in Taiwan. What do? Well, Taiwan has single-payer health insurance, which means that every Taiwanese citizen and foreign resident is covered by a government-run health insurance plan. You can purchase additional private health insurance on top of the government plan, but the vast majority of Taiwanese people don't do that, since government insurance covers nearly everything. This system is also known as National Health Insurance, or NHI for short. For example, teeth cleanings and extractions, those are covered by National Health Insurance. Teeth bedazzling and cosmetic veneers, those are not covered by National Health Insurance. What about Chinese medicine and acupuncture? Actually, that's covered. Taiwan's NHI covers 6 acupuncture sessions per month, as long as it's a treatment for a specific injury and not just a way to unwind after work. There is no way to opt out of the system, because uninsured people are a serious pathogen risk on an island with so many diseases. Here's how it works in practice. When you get sick in Taiwan, you make an online appointment with a specialist or a clinic, or you go straight to the hospital if it's an emergency. There's a flat registration fee for appointments of 50 NTD, which is about $1.60 in US dollars, while emergency visits are a bit more expensive. You don't need a referral, you don't need to spend months waiting for an appointment, you just show up, scan your government-issued insurance card, and wait for the nurse to call your name. Here's the magic. In Taiwan, if you see a pathogen doctor, you pay the set out-of-pocket fee for an appointment with the pathogen doctor, regardless of whether you have a serious pathogen or just a case of the common cold. It doesn't matter if you need 1 test or 10 tests, you pay the same fee for both visits. In many countries, the hospital can increase profits by sending the insurance provider an itemized bill with a bunch of unnecessary charges. Blood test, fecal test, skin test, pregnancy test, syringe fee, aspirin fee, Q-tip fee, paperwork fee, etc. But that trick doesn't work in Taiwan. The Taiwanese government gives hospitals a lump sum operating budget, so the costs of whatever care you receive are already priced in. That means hospitals can't game the system by running unnecessary tests. You might be thinking, wait, so you're saying that hypochondriacs pay the same price as patients on death's door? Doesn't that mean healthy people are subsidizing sick people's healthcare? Well, yes. But with this system, hypochondriacs are subsidizing sick people's healthcare more than any other healthy person. Here's how all health insurance works on a basic level. Lots of people put money into a big pot. With NHI, that's collected through taxes. With private insurance, that's your monthly premium. People who regularly put money into the pot earn the right to take money out of the pot to pay for medical care, even if the cost of care exceeds their contribution to the pot. All insurance is just betting on misfortune. If something bad happens, you get a payout. If nothing bad ever happens, well, then congratulations. Your reward is the satisfaction of knowing you are a statistical anomaly. After all, in Taiwan, everybody gets sick eventually. But wait, if the government is paying the bill for everything, what stops pharmaceutical companies from jacking up their prices? When the government is the single middleman between healthcare providers and healthcare consumers, it has massive leverage to negotiate lower prices. Group negotiations are key to cheaper healthcare costs because individual patients cannot negotiate when they're sick or injured. People are willing to pay any price when the alternative is death. But in a single-payer system, the government negotiates a fair price on your behalf before you ever even get sick. But Taiwan's system has taken this a step further, locking in prices that are even lower than other NHI systems in Europe, for example. In Taiwan, there are no long wait times because hospitals, clinics, and pharmacies are mostly privately owned and locked in a fierce competition to secure funding from the government. How does the government keep medicine costs so low? And why are over-the-counter medications so cheap in Taiwan, even without government involvement? To answer these questions, we need to look at the history of Taiwan's transition to NHI. Before Taiwan had universal government insurance, it had a system more similar to that of the United States. That is, instead of Medicare for all, Taiwan had Medicare for some. 50% of Taiwan's population was covered by a government insurance policy. At the time, only civil servants, laborers, and farmers were eligible. These patients would go to the hospital, and the hospitals would send the government a bill for whatever services they provided. This program was the launchpad for the government's campaign to slash healthcare costs for all Taiwanese citizens. Here's the recipe. Step 1. Based on the data from people in the state-run insurance pool, the government did an internal audit on the prices that hospitals were charging for various medicines across Taiwan. Step 2. During the transition to universal NHI, the government used that data to decide reasonable prices for these medicines and released a report detailing how much the government was willing to reimburse hospitals for each medicine. These prices were public information, so if hospitals tried to overcharge patients to maintain profits, the patients would know about it. Step 3. Every few years, the government does another audit on the prices of medicine. Hospitals must submit bills showing how much pharmaceutical companies are charging them. Since the government sets a hard line on the amount they would pay for each medicine, hospitals have only one way to increase revenues: playing hardball. They have to negotiate even lower prices for medical suppliers. But because of the government audit, if one hospital gets a sweet deal, that information eventually gets released to the government during the audit and signals to the government that they can set a lower reimbursal amount across the island. In practice, that means if any hospital gets a good deal on a drug, that deal is eventually available for all hospitals purchasing that drug in Taiwan. Step 4. If drug costs are still rising, the government has a magic escape hatch: reclassifying prescription drugs as over-the-counter. This is the same as revoking coverage for these medications, but it actually saves money for both patients and the government by reducing unnecessary barriers to simple healthcare. Think about it this way. If you see a worm in your poop because you ate a kale salad, what would you rather do? A. Schedule an appointment, take off work, go to the hospital, talk about your poop with a doctor, poop in a cup, wait for test results, talk with the doctor about your poop some more, pay a $5 USD copay for the visit, and then get a prescription for deworming pills. Or B. Walk to the nearest pharmacy, discreetly ask the pharmacist for a box of dewormer, pay $3 and go home. Contraceptive pills, inhalers to treat asthma, anti-parasite medications, and corticosteroids for arthritis, and more, are all available cheaply, over the counter, no prescription required. By removing the prescription requirement for simple medications, the government can pull the rug out from hospitals, cutting off the revenue they earned from these medications, and signaling to them that they need to improve their behavior, or else lose further market share to mom-and-pop pharmacies. In most parts of Taiwan, there are multiple family-owned pharmacies within walking or scootering distance, so competition is fierce. Why aren't there more family-owned pharmacies in the US? Subscribe and hit the notification bell so you don't miss our upcoming video on East Asia's formula for helping small businesses flourish. Taiwan's government health insurance doesn't cover everything. For example, glasses and dentures are not covered because the bureaucracy needed to absorb these sectors is more trouble than it's worth. Instead, costs are kept low in these sectors by cutting red tape. Dentures can be fitted by dental technicians instead of by a dentist. Shops that sell glasses offer free eye exams, and professional eye exams done in hospitals are dirt cheap in order to stay competitive. Compare this with the United Kingdom, where clinics bill the government for eye exams, and the NHS doesn't cover glasses, but still has 10 different types of vouchers subsidizing the cost of glasses. Now that the Brits aren't watching anymore, we can address your burning question. Why can't we have this system in America? The standard politician's criticism of single-payer goes something like this. What about the voters that like their current insurance company? Medicare for All wants to take their beloved insurance away. Here's the problem. Nobody loves insurance. Not even actuaries, who might point out that you are in the 0.1% of people who can actually focus long enough to watch a 15-minute video about health insurance. What people do like is efficient, compassionate healthcare, not the insurance itself. This distinction is important. Insurance is the middleman between healthcare providers, like hospitals, doctors, and pharmacies, and healthcare consumers, who are people like you. So what's really happening here? Remember earlier when I said that this system relies on healthy people subsidizing care for sick people? Health insurance companies realize that charity is not a compelling motivator for many Americans. These companies have created a divide-and-conquer strategy, and now the United States spends 17% of its GDP on healthcare, without even covering the whole population. In reality, private health insurance requires you to subsidize way more than just other people's care. Remember, private insurance is not your family doctor, pharmacist, or X-ray technician. Private health insurance is a sweeping bureaucracy of probability analysts, ex-lawyers turned terms and conditions writers, corporate executives, and agents who get bonuses for finding ways to deny people coverage. Your monthly health insurance premium pays all of those people's salaries. To this end, private health insurance companies can jack up premiums across the board. The cost of family premiums has been rising faster than income for the past 20 years straight in America. So, how much money exactly can the American people save by reducing healthcare bureaucracy? I'll let the experts answer that one. By paying hospitals lump sum operating budgets rather than forcing them to bill per patient, Scotland and Canada have held hospital administrative costs to approximately 12% of their revenue versus 25.3% of revenue in the United States. Single-payer reform could save approximately $504 billion annually on bureaucracy. The reality is that everybody gets sick sometimes. If you live in America and believe yourself to be young and invincible, you're setting yourself up for bankruptcy. And if you are the unicorn voter who actually loves your private health insurance plan, let me leave you with this thought. Single-payer healthcare restores choice and market competition in every way that actually matters. Healthcare markets are inelastic on an individual level. If you are bleeding to death from a stab wound, you don't have time to shop around and find the cheapest provider. Even for chronic illnesses, You are limited to the hospitals, doctors, and treatments that your insurance is willing to cover. Government insurance restores competitiveness, and it'll save us some money in the process. Do people eat raw vegetables in your country? Leave us a comment down below. For more about how diseases have altered the course of Taiwan's history, check out our video on successful invasions of Taiwan. I bet Koxinga's ghost would be very proud of how far Taiwan has come today. Thanks for watching. We'll see you next time.